Child Protection Week takes place in South Africa from the 29th of May to the 5th of June. It is commemorated in the country annually to raise awareness of the rights of children as articulated in the Constitution of the Republic of South Africa and Children's Act. This year's theme looks at protecting children through COVID-19 and beyond.
In 2021, the Health Department reported that the rate of teenage pregnancy jumped to 60% since the start of COVID-19, whilst figures from the Gauteng province showed that more than 23,000 girls under the age of 18 gave birth during that period. Now, joining us this morning to discuss this further, we'll be looking at our guest this morning, an advocacy manager at the Women and Men Against Child Abuse organization, Nga Murombezi. It's good to have you join us. Good morning.
All right, so let's hope that Nga can join us. She's having a little bit of a connectivity issues, but of course she's supposed to be here to look at how the organization has been commemorated national. Okay, thank you so much, Nga, for being here. Now, how is the organization, how is the organization being commemorated National Child Protection Week? We do understand that it started since May, if I put it that way.
Good morning. Sorry, I'm hearing a feedback, but yes, Child Protection Week in South Africa started on the 29th of May, and we are focusing on teenage pregnancies this year. And this is in response to 23,000 teenagers that were reportedly pregnant and delivered live children between 2020 and 2021. So our focus this year is on how to combat teenage pregnancy.
All right, Nga, there's so much that's happening as regards children, and we know that the Constitution and the Children's Act is adhered, it provides for the protection of children. But would you say that the provisions of the Constitution as well as the Children's Act is being upheld by communities and the government?
It's really very difficult to say unequivocally that yes or no. And the challenge is that there's different laws that influence the Constitution and its applicability. This is not only towards children, but towards all issues affecting citizens in South Africa. Now, when you come to children, you understand that children cannot activate their constitutional rights in the absence of an adult. And more often than not, children are being abused by the adults that are supposed to be protecting them. When we look at the issue of teenage pregnancy, access to education, access to healthcare services in particular, we find that these are being violated and resulting in extended child abuse. Then we take a look at the ability for children to exercise their agency in terms of economic capacity. Now, that is not to say that children must be working and providing for themselves, but we find issues such as the Blesser syndrome becoming very paramount in South Africa. And this is because children are being affected by the socioeconomic realities in the country. So constitutional rights are very nice and well detailed in our constitution, but other laws allow for people to navigate them and use them as a tool to abuse children.
All right. Nga Murombezi, I think right before we go straight to the next question, let's give you a few seconds to actually handle the audio feedback that we're listening to, or we can hear from your end, while we also take a look at a few statistics right before we come back to you with the next question. Well, the next question we want to take a look at, Olive, is the question that's got to do with the fact that South Africa is looking at the Child Protection Week, and we're also looking at the fact that drug abuse is a major concern. Hopefully when our guest returns, we'll take a look at this question. Drug abuse is also one of the major concerns. We've seen cases of rape, which is also a major concern as well in South Africa. And we've seen cases of vices in which these youths indeed get engaged in, entangled with. How the possibility is to help these youths to get freed from this problem is one thing that I think should be a topic of discussion.
Absolutely. I mean, it's not just in South Africa. Our children around the continent are struggling. We did see the expose that was done by the BBC talking about tramadol and how it's being abused. So we've seen that drug abuse is indeed a problem. It's become very fashionable. What we find among the younger generation is that in parties, it's looked upon as something fashionable to indulge in, right? And these are the things that birth teenage pregnancy. Of course, she was talking about teenage pregnancy and how the rights of children are not being able to be enforced by them and the adults who are supposed to hold these children, who are supposed to look after them are the ones abusing them. So you find it's all interrelated. There's the abuse of drugs because if sometimes in some way find it fashionable, they abuse it, get into compromising situations, and then we start to see teenage pregnancies. But we must do more to look out for our children. I'm really proud of South Africa and the South Africa Children's Week, and we hope that this will indeed yield more effect than that, or yield as much effect as we expect. We have our guest Nga joining us. Nga, let's look at still looking at the COVID-19 pandemic and how it's changed lives around the world. What would you say has been the most notable impact of COVID-19 on children in Southern Africa?
Thank you very much. So sorry about that. So we find that COVID-19 really had an economic impact. And I really want to draw back to the fact that children have no agency to exercise the things that they need to survive. In South Africa, we witnessed a lot of parents and caregivers lose their employment. We had the implementation of the COVID relief grant, and that was also impacted because a lot of people don't have the basic provision of the Constitution, which is the right to identity. And the right to identity is needed to access that grant. But in extension towards children, the children's grant needed that child to have a birth certificate. And things such as home affairs, where the birth certificate was going to be obtained from, were closed. So children suffered the secondary trauma of COVID. Outside of being unable to access healthcare services, they were even unable to access the economic relief that had been put into place. So that's one side, the economic relief. Then we take a look at access to services such as schools, because you know that a lot of children who are heavily impacted by poverty sometimes only get a meal at school. And the reality is, in a lot of our lower income communities in South Africa, children are getting one meal, and it is as a result of being at school. So a lot of children were sidelined from there. Then we take a look at the response from entities such as SAPS as people report abuse. Perpetrators and victims were closed in one space because we were not accessing the homes of where we usually access the children. So COVID really sealed children out of any access to service provision, any access to protection. And it resulted in a lot more children being abused physically and emotionally, but also children feeling the remnants of a constitution that doesn't actually implement its provisions. And by that, I mean that when you look at the Department of Social Development and what it is supposed to do towards children, so the right to healthcare, for example, if children have no access to healthcare facilities, it is the duty of that entity to go and ensure that within communities, through community engagement, through outreach programs, they work with civil society to ensure that children have got access to healthcare. We had a lot of children who were unable to access things such as sanitizer, running water, face masks. So the basic preventative measures put into place for COVID were not accessible to a lot of the children that we work with. So I think if we look at the grander scheme of South Africa, what COVID did was to really bring us the reality of the remnants of not dealing with apartheid, the history of apartheid. Because also infrastructurally, a lot of places became remote. They could not be accessed. So outside of just children being affected by the pandemic in terms of the virus infecting them due to limited healthcare services, a lot of societal issues really played down. And because children without that agency, they couldn't do anything. Literally, we had children sitting and waiting for somebody else to ensure that they are okay.
All right. Well, the health department disclosed that over 138,000 girls between the ages of 10 and 19 years old gave birth during 2020 and 2021. What is being done about the protection of young girls, and are all stakeholders involved doing enough to really protect children in the country?
Okay, so just to clarify that number, 23,000. And these are reported cases. So the challenge with that is, it wouldn't be surprising that a number of over 100,000 is the reality, but these are reported live births, and these are children aged 10 to 18. Now, there's a very big concern when we say a 10-year-old is a pregnant teenager. By definition, a 10-year-old is not a teenager. And when you look at the definition of teenage pregnancy, it classifies it from the age of 15. So in those 23,000 children who gave birth to live births, a significant portion of that were children that were raped and resulted in a pregnancy, because you cannot negotiate it. It is not children experimenting with sex, because anyone under the age of 12 cannot consent to having sex. So the first issue is, how do we define it? And the back end of your question is, are stakeholders involved? And I'm going to say no to that, because us as an organization and many in the sector find that we are excluded even on the premise of research. If we were involved in research, the feedback that 23,000 children aged 10 to 18 gave birth would actually have been revised, because it is misinforming the general public when we say that in 23,000, 10-year-olds are being classified as teenage pregnancy, right? So the first issue is the definition of teenage pregnancy. Then we really have to go back to the element of educating on consent and sexual capacity. Now, when we look at the definition of statutory rape in South Africa, it has been revised and reviewed many times. Now, we are looking at decriminalizing what is actually juvenile sexual experimentation. Now, that means that any child who is over the age of 12, which is the age of consent, is able to partake in sexual activity. I say that very loosely, but that is generally the definition. Partake in sexual activity with anyone under the age of 16. That means that 15 years and 353 days is the cut-off age. The moment somebody turns 16 and they have sex with somebody who is 15 and that number of days, that is now a criminal offense. It ceases to become juvenile sexual experimentation. But anyone who is 12 and 13, 12 and 14, 13 and 15, whichever way within that group, that is, we want to decriminalize it. But the reality is our courts are yet to catch up with the reality that is being presented by researchers. Two reasons informing that, and it feeds into teenage pregnancy and how we respond as society. The Morality Act in South Africa used to govern sexual behavior. And basically that meant that we demoralized sex, and it was an immoral act. And so how we as parents teach the generation that we classify as teenagers is we put a moral element to it, and we lose them in the conversation. So we have a lot of teenagers and children having sex that is concealed, that is unsafe, that is misinformed, and where their review mechanism is their peer. By that I mean they sit at a lunch table and they talk about what they may or may not have witnessed on the many sexual platforms that are available on their mobile devices. And that is a dangerous thing, because we are allowing children who have no extensive knowledge and understanding cognitively of sex to inform other children who are equally as limited in their understanding, right? Then we take a look at what happens when these children do fall pregnant. Because often in our communities, in civil society, we understand when children come to us and they say, but I had sex once, or they don't even understand that it was sex, because they don't understand the physiology of how semen is released from a penis and what the probability of pregnancy is in line with that. So that very limited knowledge is why we find a lot of children falling pregnant. Then we look at the element of rape, because South Africa is unfortunately one of the highest countries who have got highest numbers of rape, especially against children. Now, a lot of the 23,000, and that's why I said the number could very easily be in the hundreds of thousands. A lot of these children are rape victims. And when they get to the hospital, there is no correlating number in the criminal justice system to say that of 10,000 of these 23,000 who were children under the age of 16 and who were impregnated by an uncle, a father, a brother, or one other adult in community, this is the person that has been arrested. So there's a big miscommunication there. So a lot of what we are facing in South Africa around teenage pregnancy is the disconnect between stakeholders who could really inform the research and the feedback, but also ask children, why are you having sex, and do you understand what sex is?
These are very important conversations to have, and we thank you for championing this cause. We, of course, will be following up with you, seeing how this is recognized in South Africa. Thank you very much for joining us this morning.
Thank you very much for your time.